Dr. Manish Arya. I am consultant pediatric intensivist and neonatologist at Lilavati Hospital and Research Center. Apart from treating children in OPD with minor health issues and providing support for vaccination, I also look after the pediatric intensive care unit and neonatal intensive care unit at Lilavati Hospital and Research Center. Our PICU and NICU is level 3 care facility where we treat critically ill children. My area of expertise is on hemodynamic monitoring, protective lung ventilation, renal replacement therapy and extracorporeal membrane oxygenation support. So today I am going to speak on a very important topic which is sepsis in children. So what are the questions which comes to our mind? So what is sepsis? Why sepsis is to be identified early? And what are the symptoms which can be noticed by the parents so that they can bring the children to the hospital immediately. Sepsis is a major health problem in children and sometimes it can be life-threatening. So significant number of children needing ICU admission have sepsis. So sepsis is a spectrum of disorder which can be due to infection because of virus, bacteria, fungi or parasites or any toxins released by them. So the early recognition and treatment is essential for improved outcome. So whenever your children is having any red flag symptoms, as a parent you should visit the doctor immediately. So as a parent you should be more concerned and visit the doctor immediately if your child is having high fever, if child is having breathing difficulty, if your child is having fast breathing, if your child is less playful, having decreased activity, or if you are feeling your child is more sleepy than usual. If your child is having acute pain in abdomen, having refusal to feed and having decreased urine output, you should also visit the doctor immediately. So these symptoms can be indicator of underlying sepsis and these children needs to be examined by the child specialist. Along with these symptoms, on further examination, if your child is having low blood pressure, if child is having fast breathing rate or difficulty in breathing, if child is having fast heart rate which is disproportionate to fever, or if any clinical or biochemical parameters is suggestive of organ dysfunction, then your child needs to be admitted in intensive care unit and needs to be monitored closely. So any further delay in diagnosis may have adverse outcome and the even ICU stay of children can be prolonged. These children may need to give the supportive treatment in form of supplemental oxygen, invasive or non-invasive mechanical ventilation, renal replacement therapy and other organ support measures. One of the most important part of ICU care is early start of the nutrition. We always advocate early start of nutrition in all our patients. So if the child is not able to tolerate enteral feeding, we have infrastructure and facility to provide them with the parental nutrition safely. The other most important aspect of ICU care is parental counseling, where we on regular basis speak to the parents and relative about condition of the child, treatment plan and also help them to understand the disease process better and also help them in their decision making. So they should have more trust in their treating physician. Thank you.